So today I'm here with Rosa Hughes, who will actually share with us her journey, her breast cancer story, and how she successfully managed to overcome her illness. And Rosa will also talk to us about how she got into thermography, because obviously that links to her personal story. And finally, we're going to talk a bit about the documentary The Promise, which is all about breast screening and the issues with the breast screening program. So welcome, Rosa.
Thank you, Eva. No, it's lovely to be here. Thank you.
Yeah. I finally got you down for this interview. It's been a long time coming. So great. I'm very excited to talk to you because, first of all, your story. Could you tell us how it was for you, obviously, through the diagnosis and what treatment you decided to have and what you decided not to have? Because I know, obviously, that you used natural approaches, so quite obviously interested to hear more and would like other people to know that it is perfectly possible to. It's not obviously right for everybody, but clearly you are one of the examples of people, and we've had more people on the show who have also overcome various health issues using natural therapy. So tell us first about when you were first diagnosed and how that affected you and what happened from there.
Well, I mean, the story started in 2006, but before that I'd realised, at least a year before that I had a lump in my upper left breast, and the lump was getting bigger. At the time I was in a quite stressful job and I wasn't looking after myself. I was drinking far too much alcohol and doing all the things that I shouldn't be doing, and basically this tumour was started to get bigger and bigger.
So you didn't actually action it?
No, I didn't straight away. No, because I was actually frightened of actually taking it all on board. And at the time I was my own breadwinner, and I thought that if I got off the treadmill, what was going to happen? I'd end up losing my house. I was self-employed. It was, and there was all those sorts of worries. So I did ignore it for over a year.
So hiding your head in the sand there a little bit.
Absolutely, yeah. And then I was travelling home from a conference. I wasn't feeling very well. I was completely stressed out anyway. And I heard something. It was October, and I was listening to women talking about breast cancer on the radio, actually. And I thought, oh, God, sounds like I've got a bigger lump than what they've got. And so when I came in that night, when I was in the bath, I looked down and you could see that it was like sticking out my chest.
All right, so the shape was
that's
different.
Right, it was, yeah. So I called my husband in, and he had a look at it, and basically he couldn't believe that he hadn't noticed, and of course it was it was a shock at how big it was for him. So luckily he was a homeopath. See, my husband's a homeopath, so it's not good to have a wife with a big lump in the chest who hasn't done anything about it. Doesn't really go down
the business.
No, absolutely not. So then I stuck my head in the sand, to be honest with you, and I ignored it, and I didn't want to talk about it, and I didn't want to make any changes, and I was terrified.
Did you accept any treatment from Phil, from your husband at that point?
No, not at that point. No. I didn't, and I didn't want anybody to know. I didn't want my family to know, and my sister and her husband are doctors, and of course I knew I'd get under a lot of pressure to do things. And Phil had done some really interesting research on mammography and the amount of pressure that's put on a woman's breast. And also he gave me some information on angiogenesis, which is your body's healing process. And biopsying can be very dangerous, and is one of the first triggers for actually spreading cancer around the body.
I think the awareness of those issues is growing
I had no idea.
But we're talking 2006, obviously.
That's right. I had no idea about any of this. So I read it, and in the end, after about a month, I told my mum. So of course I went around with the whole family that I had this lump and all that, and then my sister and everybody came on mass to our house to drag me to hospital. And Phil just said, no, we're going to see if we can find something else other than going in and having a mammogram and a biopsy at this stage. To be honest with you, the whole time for me was a blur. I don't remember very much about it all because I was that frightened at the time of everything that was happening. It's like I speak to women every day now, and you go in and you get a cancer diagnosis, and it's like a voodoo word, But as soon as they say you have cancer, you don't remember anything else. Absolutely.
Yeah.
So they can be talking about all this treatment. You won't even take it on board because you're in shock. And I suppose I was a bit like that with all of that going on. Anyway, from there, my mum agreed to go home and leave us to get on with things for 3 months. Phil had found this thermography, which is a physiological look at the body. So it's not like a mammogram, it's completely the other end of the spectrum. Mammography uses like X-rays to see inside the body, and it can detect lumps using radiation, as we know. Whereas thermography is a physiological look at the body, so you don't see structure, but you see blood flow and activity. So
what maybe people may be familiar and may have seen sometimes when you look at houses and you look at heat exchange.
That's
and
right.
How
that's right.
And it works. It works very much.
Or
in
the police
exact
chasing
same
somebody.
Way. Yes, that's
chasing.
correct.
Exactly.
Exactly.
Like night vision things. Where they can see, picks up the heat. Yeah.
So when you scan, when you do thermography scanning, you get pictures
that's
that
right.
are the
that's right.
The bluish, greenish, reddish.
That's right. That's right. But it's more the blood flow because your breasts are in good health. They're symmetrical. So kind of what goes on one side tends to go on the other. So when people think that when they have a breast tumour, that breast tumour's just suddenly arrived. It doesn't work like that. It's been there for many years, before you get to the stage where you've got the tumour. But the area will become warmer, and there'll be a blood supply, and basically it will. So you actually see those physiological changes before the anatomical changes. So thermography is a good way of seeing things early. If you've got a tumour in your breast and it's active and it's cancerous, then it will have its own blood supply. If it's a cyst, then we won't see anything because, of course, we don't see structure. We don't see the lump, but we see the blood supply. So Phil had found this, and there was only a few cameras in the country then, and I ended up going down to Harley Street to have my first thermogram. So I went down there and had the procedure that I now do with women all around the country, and my first results came back, and it was awful because it came back for high risk for malignancy. So that really confirmed without me having a biopsy that I had a problem. So I refused to go for a biopsy, and I've had hassle from doctors saying, well, you never had it in the first place. I mean, but they're cutting off women's breasts with calcification. This was a big tumour, and you could see all the activity on it.
Yeah.
So in my report, it came back for 97% risk of malignancy at that time. So it's pretty high. So I had to get my act together. So I then decided to... Oh, the other thing that happened to us as well, there was a film called The Secret that came out. I don't know whether... Yeah. So that was in 2006. And there was a woman on there, because I didn't know if anybody had cured themselves of cancer, And then there was a woman on there that healed her breast. So that spurred me on. So Phil had read a lot. So he got me on the Philip Day... do you know Philip Day from Credence?
Yes.
Yeah, so he bought me all his books, and basically I followed his alkaline diet and all that sort of stuff. And I took ACCT, I took lots of supplements and vitamin C, vitamin D3, all the usual things.
So you made loads of changes in terms of dietary changes.
I cut out alcohol. We started filtering all the water. I had the house swept for radiation and things like the phones and the dock for the phone.
Yeah, we do underestimate just
Absolutely.
how much
The
impact.
radiation.
I mean, we are electrical beings.
I know.
So
I know.
You have to appreciate that all those devices that we have around us will interfere with our bodies, most definitely.
That phone was underneath our stairs where we had the main phone, and the radiation was fanning out into 3 bedrooms upstairs. And then when we turned that off and got rid of it, the whole house went dead. So Wi-Fi, we went back to plugging in. I switched off my mobile phone for 6 months. I stopped wearing a bra. I stopped having my hair tinted, and I use like a herbal hair tint rather than one of these other.
So it was massively reducing any radiation, reducing toxicity as much as possible.
Microwave, of course, that went.
Yeah, and then we've got the change
cleansing,
in terms of pH balance, alkaline diet. We know there's a lot more evidence now, obviously, than there was in 2006. How much that benefits. The body.
That's right. And I still ate a lot of like organic oily fish and things like that. So I didn't go completely like vegetarian or anything like that. So, and I exercised as well. And it wasn't just about all that. It was about changing my whole mindset on things.
I was just going to ask how much your mind, changing the mindset actually, played a role.
Absolutely terrified. I'd wake up in the middle of the night, 2 o'clock normally every morning. I would be waking up just thinking I was going to die, having complete panic attacks, and Phil was feeding me.
We know very well how much stress suppresses the immune function. So you're in a situation where you need all the immune support and all the support from your immune system that you can get. But yet you're lying there stressing and having panic attacks, which of course works the opposite way. So that's such a massive element in recovery from cancer or any condition that is obviously linked to immune function.
That's right, and that's one of the things that I learned was transcendental meditation, because I actually moved my daughter out of like a normal school into the Maharishi school in Skelmersdale in Lancashire, and they meditate 3 times a day there. So the parents also have to learn to meditate. So there's a lot of things change when you get this sort of diagnosis. But what my husband said to me, and to be honest with you, without him, I wouldn't have done any of this. One of the things he said to me, he said, "You've had that tumour for many, many years, okay? If you don't do anything for the next 3 months, nothing is going to happen to you." Because there's all this thing that they rush people into things that are really... It's too fast. Women are rushed into these really invasive treatments before they've even tried to even heal the process.
Or had any opportunity to really think it through and do their research.
Absolutely. It almost seems that they have to get them in fast and get all this invasive treatment done before they've got time to do anything. And what we did after having that, Phil said, right, well, let's do this regime for 3 months, and then we'll go back and we'll have your next thermogram, and then we'll see if there's any difference. So that's what we did. So it wasn't that I wasn't going to do conventional treatment, but the more I
you were
looked
not
into
averse to it per se, but what Phil was quite right. Well, 3 months is not actually going to make that much of a difference in the grand scheme of things. Let's have a different approach and see what change we can make. And if we can't make any, then we'll obviously think of other things.
That's right. That's exactly the way that we went. And of course, with thermography, you're picking up the physiological changes. So these are the things that happen before the anatomical changes. So although your lump might not have shrunk, the activity around that lump may have changed.
And of course, if you reduce the circulation and blood supply to the lump or tumour, then of course you are actually starting to kill it. You've started, obviously, because it's got no way of functioning without that blood supply. So, and you see that on the thermogram.
Yeah, you do. And he was saying to me, don't even worry if you go back the first time, because what happened, went back the first time and there wasn't that much difference. But it was stable. So that meant that the cancer cell doubling time hadn't speeded up. That everything was, so that spurs you on then to do another 3 months, and we went on like this. I mean, it was a horrendous time because I wasn't earning any money. We only had so much money in the bank, so it got to the point where I didn't have enough money in the bank to pay my mortgage and things like that. So within the first year or so, I'd gone through having my house repossessed. I was made bankrupt. But it was, do you know what? It was the best thing that could have happened for me, because it freed me up. And by then, I was, meditating every day. I felt better than I've ever felt in my life.
Yeah.
And
it's like you regain control of your life
absolutely,
again. That's essentially what
happened. And I started actually thinking about what I wanted to do and where I wanted to go, and I'd never had that opportunity. I'd never had an opportunity where I wasn't working to even think about any of these things. I'd never even had the opportunity to walk to the shops. I'd always gone in the car, to even look at people's gardens, just things that you just take for granted every day. You suddenly start thinking about. And what actually happened with me is I started, using that law of attraction and started visualising where I wanted to go, where I wanted to live and all that. And I ended up, I had this vision board, and I wanted to live somewhere more environmentally friendly, and I wanted to have goats and chickens and guess what? I now live on a farm and I've got all these animals, and
wonderful.
And at the time, I wanted to do.
So you were very much focusing on recovery and what your life was going to be like post-recovery,
absolutely,
as opposed to just continuing to stew in the fear, of what's going to happen to me, am I going to die, and all of that. So, and that's a very important shift.
It is,
because there is not a single cancer survivor out there who would have, they will all say the same thing, that it was the focus on the recovery and how great your life was going to be after you've got rid of it.
That's right.
As opposed to just sitting there fearful, thinking, am I going to die?
Absolutely. And what actually happens is when you're worrying about your body all the time, you can't really look out. You're kind of making these plans in your head of where you're going, but then when you start getting good news, and you see things starting to get better, you feel then that it's more time to come out and start helping other people in similar situations. I mean, the amount of hours that I have thought about everything that's going on here, and also my own situation, and how now I'm so grateful for it. I still have my tumour. I never got to the stage of having it removed, but it's dormant now. Both of my breasts are low risk, and I now, instead of scanning every 3 months like I was like mad, doing it all the time when I first was aware of the tumour, now I only do it once a year. But I've really grown to love my breasts, and they're not perfect. They are breastfed, but just a total appreciation of how beautiful breasts are. And also, I think, just falling in love with your tumour. I know that sounds really mad, but I don't know if you understand that, because it was such a life-changing event for me.
Yeah, I actually had Brian Reed previously on the show, who actually said cancer saved my life.
Absolutely.
In a different way to you, but the message is very much the same, because he was morbidly obese, and he was, in his own words, a heart attack waiting to happen.
Yeah.
And it was his throat cancer that obviously made him change and turn his life around completely, because he had to make all those changes. There was nowhere to hide. He had to do it.
Yeah.
And that's basically what he said, that cancer saved it. So what I hear you say is that somehow that experience gave you your life back and made you, presented you with options that you wouldn't have previously considered.
Absolutely.
So in the end, you ended up creating possibly a much better life for yourself, a much happier life for yourself.
Absolutely.
So I do
and
understand
a big turning point, I think, because I see this an awful lot, because I'm seeing women every day, is how much women are dependent on alcohol in this country. How I was. And how that makes the body super acidic, dehydrated and oxygenated, but also it's a depressant. So I'd had bouts in my life where I was depressed. And I used to use alcohol if I was happy. I used to drink. If I was sad, I used to drink. Mm-hmm. If I had a row with my partner, I'd have a drink, I used it as a crutch. Mm. And I'd never seemed to be able to get myself out of that. In my adult life, and as life had gone on, it got worse and worse. So, as I got older, you're drinking more because it's so acceptable everywhere you go. It's alcohol. So
I know a few people who drink half a bottle to a full bottle of wine most nights,
Absolutely,
and they don't think that's a problem.
No, I know, and I used to be able to do that.
Wake up and smell the roses, people. That's,
I know,
you're on the verge of alcoholism
absolutely.
there.
And when they did the Million Woman study, alcohol was the big thing for breast cancer. Of course, the pill and HRT, they were the two mega things, messing with women's hormones.
Yes, of course.
But alcohol and smoking cigarettes had a bigger affinity with cervical cancer. Yeah, but having to give up alcohol, I had a night, and really awful night on alcohol, and that finished me off completely, and that no more ever again would I ever put myself in that position. But from that, my life got better the moment I stopped drinking alcohol. I had more clarity. Things became that, and doing meditation, everything became clearer. My whole energy became lighter, and I could never go back to that now. Never go back there ever again. And if women knew how their lives would improve if they stopped drinking, I just think, just give it a go. Just give 5 weeks of not drinking alcohol, and you'll see a major difference. I have never had, even with everything I've gone through since I did that, I've never had a day's depression. Never had a day's depression since then. Just completely living on a different level to how I did. It was like actually living in chains.
Yeah, I mean, obviously every other person these days seems to be on antidepressants. I wonder how much that is to do with alcohol consumption.
Because it just brings your whole vibration down. Now, what I need to tell you about as well is that my husband, and with the help of his other homeopathic doctor friends, I got treated homeopathically as well, which, just changes the energy of things. I was given various remedies as I went along. I was given one of them is scrinum, which is like breast cancer nosode. And over a 2-week period, that tumour shrunk taking that. And I could hardly believe it myself. And it was only after my mum came, and actually I hadn't seen her for a few weeks, and she felt my lump. She said, "My God, Rosa, that is so much smaller than the last time I saw you." So I had that. I had phytolacca. I had conium. These are homeopathic remedies. And carcinosin. There's been this research paper now written showing that these homeopathic remedies actually kill cancer cells without harming healthy cells. And I hadn't realised, but I'd had most of the remedies that were on this paper. So that was truly amazing. And I know Phil sent all that info to What Doctors Don't Tell You magazine, so they've actually featured it now in their magazine. But it's amazing what you find out as you go along. So anyway, really, I just got better and better and better, and my life got better and better. And then I got in a position with a friend of ours who actually funded our first thermal imaging camera, because I thought people have to travel all the way down to London, and because I just thought, I called it the good news camera, because every time I went back it got better. And that spurs you on. It really spurs you on, So that's why a lot of people come, so they can monitor the changes in their thermal pattern. So then
it really does. I mean, obviously I had lumps in my breast, and I had thermography, and it really does put your mind at ease.
It does, really does, and it grades your breast. They grade your breast. So they grade it from like normal breasts up to kind of confirmed malignancy. So kind of normal to low risk to some risk. These are all kind of like benign things that are happening in the breast. And then the next grading up is increased risk, and then high risk for malignancy, and then for confirmed malignancy. So when you come for a thermogram, they will both of them will be graded. And one may be different to the other, of course, Because most women have one healthier breast than the other breast, Anyway, so I went and learnt about thermography, and then started as a clinical thermographer. And really, I haven't looked back since then. So I scan lots of different people. It's not just people with cancer, but my main thing, and my husband's main thing is to change the way we're looking at things. And we always say that we shouldn't be looking at Breast Cancer Awareness Month, October. we should be looking at Breast Health Month, because women are so disempowered at this moment. It seems that everything about the breasts is about disease. You can't mention breasts without breast cancer and breast lumps and people dying and chemotherapy and radiotherapy. And really, breasts are, they're very simple.
Yeah, there's a
structures.
Negative connotation there.
Yeah, you know, and to me, it just seems that the only way of dealing with it's not just breasts, it's wombs as well, it's uterus, you know. As soon as something starts happening to a woman, the first option is to amputate. I mean, like, if you suddenly found out that you had diabetes, the first thing wouldn't be to have your feet chopped off, you know, just in case.
Or your pancreas removed.
That's right, I know. I mean, it's just madness. But in this country, we have this problem that we have a law, and it's called the 1939 Cancer Act. And what that act says is that doctors cannot treat anybody for cancer here in the UK unless it's with chemotherapy, radiotherapy, drugs or surgery. Now, when I had I still got my tumour, when all this flared up for me, I was like, I don't want to take chemotherapy. I was like, Phil, how can you poison somebody to health? You know, I don't want that. Yeah, radiation, you know, even the signs is like somebody running away. Why would I want to do that to my body if I was ill, you know? It just didn't make sense to me at all.
And often what they give you in terms of statistics, in terms of how much it actually improves your chances of survival, those percentages are very small. So essentially
Yes,
putting
absolutely.
your body through hell
I know.
for not a lot
That's
of
right.
return, if
Yeah.
you will. So personally, to me, it makes little sense. But of course, you know, people need to assess those things on an individual basis.
Yeah.
But it's good to know that there are other ways.
Yeah, and let me tell you something, because I only learnt this year. I actually screened a German doctor earlier on in the year. She was a a trained GP, as we would call it, but also she was trained as a naturopathic doctor and a homeopathic doctor.
No, it's more common in Germany than it is in anywhere
But
else.
did you know that Hitler brought out a law at the same time in Germany? But his law said that, because he was quite into alternative medicine as well, and his law said that German citizens could choose their mode of healing. So over there, you do get a choice. Okay, the pharmaceuticals are still, very much in the forefront over there, but you do have a choice. So I'm finding a lot of the women that I see, and men that I see that have had cancer, actually don't have their treatment here. If they've done their research, they'll go over to Germany or some of the other European countries, because their cancer survival, the absolute figures for cancer survival are far higher. We have one of the worst in Europe. And our figures around about for 5 years, if you're looking in absolute, not relative terms, in absolute terms, is less than 3%. Now, when Phil, my husband, and Phil, he does all the research. He's fantastic. He researches all the time. And he started looking into mammography and routine screening, because since we started screening in 1987, and it was our country that started it. In fact, it was Margaret Thatcher who apparently had upset a lot of women, and women weren't voting for her. So 2 weeks before the general election in 1987, she introduced the first routine breast screening in the whole of the world. And it was brought in, a promise to women in the UK that it was going to bring down mortality in breast cancer and find the disease earlier. And basically that hasn't happened. Before they introduced routine screening in 1987, there was about 10,000 women a year being diagnosed with breast cancer. But genuine breast cancer, women that had problems, they had either inverted nipple or they found a lump, or they'd gone along with breast problems. We'd never routinely screened women then, healthy women. So they'd go along, they'd have a mammogram and basically, and probably ultrasound, biopsy, because that's the procedure in this country. But then suddenly Margaret Thatcher brought in this scheme that meant that every woman in the UK, once she reached age 50, could then have routine breast screening every 3 years, to find this disease that had been killing women for years early, and to hopefully bring down mortality rates. Now, most women in the UK think that's what's happened, but that isn't what's happened. My husband has just done now 8 years of research on this and produced this film that we were talking about before called The Promise, which is based on really what we've seen clinically and also research from doctors from all around the world. And basically, it's not a good thing. I don't know whether you've seen our website, but Switzerland are stopping routine breast screening for women now. And in the film, we interviewed Professor Michael Barn.
Yeah, that's an interesting one, isn't it?
Absolutely. And he was an eminent breast surgeon down in London at the time. And Margaret Thatcher asked him to actually set the scheme up. And he said that before they started routinely screening, like healthy women, they'd never seen things like bits of calcification and these small lumps that they started seeing once they started looking at healthy women. So he'd have these women coming in, they'd give them a mammogram and they'd find like these little specks and these little small lumps that would never actually have harmed a woman in their life. But they started looking at these and thinking that they were early cancer, and they even changed the name of it from like calcification to ductal carcinoma in situ. And so they started treating women, telling women that they had early cancer, and there's absolutely no evidence anywhere to show. There's been one lot of research done here at the Sloan Project, and basically they haven't been able to find any evidence that this calcification or these like small tumours have the ability to metastasise or turn into anything. And doctors are telling women that this condition has a 50% chance of turning into breast cancer. So women are frightened. They think they have breast cancer.
Naturally, yeah.
And they agree to have
all those crazy procedures.
All these, surgery. And what Professor Barn was saying is that it's not just, one lump. It's like little bits of calcification. So they can't just do a lumpectomy and take a lump out. So they're cutting women's breasts off. So they've agreed in this country that about between 4,000 and 5,000 women a year here in the UK are being treated for breast cancer they don't have. So in 1997, Professor Barn called a meeting of everybody involved in the breast screening service and the top people and said, look, we've not changed any of the mortality figures. All screening has done is changing healthy women into breast cancer patients.
I know a couple of people who are suing as a result of that.
Yeah, absolutely. Yeah. So he said, we need to tell women the truth about screening. And he was told at that meeting, we can't do that. He resigned at that point. He just could not go on doing that to women anymore. And he resigned. And they tried to do all sorts of awful things to him, of course, and blacken his name, and
the paradox being that whilst he was instrumental in terms of introducing the scheme in the first place,
absolutely.
He is now the harshest critic of it.
Absolutely.
Which is really interesting, isn't it? I know.
So, but we've carried on doing this so much so that now it's like between 40 and 50,000 women a year in the UK they're diagnosing with cancer, but what a lot of people at the top are saying is that, well, not the people that are part of the screening service, but scientists and everything, that actually it could be one of the worst things that could have happened to women, because we'll probably find that up to 75% of these women should never have been treated for anything. And a lot of these women have gone on and had radiotherapy, chemotherapy as well. Lives have been completely shattered, and it's not only the physical side of it. I know the effect that being told you've got something that could be malignant has on you. Your whole life changes overnight.
Yeah, it's an emotional trauma, just as it is physical.
Absolutely. So these women, and they've agreed to all these things that they've never needed. And a lot of them are put on tamoxifen, which we know is a known human carcinogen, for 5-10 years as well. And it's the whole thing is madness. And it's almost as if they want to keep women in this disempowered situation. And since we've made this film,
so that was the point of the documentary too.
Yeah, the documentary.
Bring this information.
What we found out is it overdiagnoses women. It diagnoses women with things that they don't have. I'm saying that mammography cannot diagnose anything. Doctors are overdiagnosing women when they look at their scans. Okay, mammography picks up things that might not do you any harm whatsoever. That's why using thermography, a physiological look, along with mammography is a good way of getting the full picture of what's going on in the breast. Because if those lumps, calcification, if there's not the heat and the blood supply that we would see with associated with a tumour, we know that it's more likely to be benign or a cyst,
Well, a lot of women have cystic breasts, and
there's lots you can do to stop that anyway. So you have more chance of being diagnosed with something you don't have if you go for a mammogram. The other thing is that they use ionising radiation. So it's actually you that gets ionised. So every woman is damaged. Every woman who goes for a mammogram is damaged. And when we interviewed Professor Ken Young, who's like head physicist for the government, he said that when you have a routine mammogram, so you have 4 shots, don't you, when you go for a routine mammogram, it's the equivalent of 40 chest x-rays. Now, you won't know at that point that you've actually been radiated. You won't feel anything. You'll feel the compression, but you won't feel
obviously the compression is another issue, of course,
that's right.
Because you're compressing very, very,
they're allowed to use up to 300 newtons. Which is 67 pounds.
Anybody who's ever had it knows just how ridiculously,
Absolutely. And so if you have got a tumour and you burst it with that, it's mad. Plus, it's harming a woman. But the radiation is a big thing. The radiation is the biggest thing because women do not know what's happening. They're told it's kind of like low radiation. Yes, it is, but it's more deadly. And the government actually have figures on how many women over a 10-year period are actually getting cancer from having the mammogram. And the saddest thing about this is that there's women out there with, you've probably heard of BRCA gene, where they have like a mutated gene. So the problem is that they cannot repair their DNA very well. So the worst thing for them is ionising radiation.
Absolutely.
So these are the women that they're taking from a young age and mammogramming every year and wondering why they're all getting very aggressive cancer, and it's from the radiation from the mammogram. It's complete madness.
And it's sad because women get pressured, if they're not properly informed, before you know it, it can all happen very, very quickly, as you said, because there's a lot of pushing around.
Absolutely, there is, and women don't know, and they think that they're getting the best. The best treatment.
That's the trust is.
Yeah, I know.
Unfortunately, yes, people put trust in their doctors and consultants.
I know. And mammography should not be used on. The reason why we don't routinely mammogram young women is before you get to menopause, you're more likely to have dense breast tissue. And over in America, there's an act called the Breast Density Act that's going through different states at the moment. And what that's saying is that if a woman is found to have breast density, she has to be told that a mammogram is not suitable for her. And she needs to either have a thermogram, an MRI, or ultrasound, because basically it can't see anything. So a mammogram in younger women is really not on because they're getting radiated, it can't see anything. And then you've got a lot of young women who have breast implants. You know, so I've got 2 girls who have actually had mammograms with breast implants, and they've burst the implant and they've now got silicone poisoning.
Oh, good God.
You know, it's madness. It's madness what is going on. So I normally advise, if a woman comes in and we find that she's got increased or high-risk reading and she wants to go to hospital, I would advise her to have an ultrasound rather than a mammogram. 1, she's not going to get radiated, and 2, it's much better for seeing things than it is with a mammogram. Yeah,
not as invasive.
Not as invasive. Yeah. So what's happened is Switzerland have are stopping routine screening, and I think other countries will start to follow. Since we've done the film, we've had a lot of interest from doctors, a lot of good stuff come through. We're actually re-editing as well, a slightly longer version with more in it.
Because, of course, a lot of people consider the documentary controversial, and I'm sure there's been a lot of bad response as well as a good response. You obviously intended to get the message out there.
Yeah, absolutely.
And whether you were going to ruffle feathers or not was not really a concern, but it was bound to happen. Wasn't it?
Absolutely.
It was bound to happen. So there were bound to be people out there who are not going to like it.
No, that's right. But there's Professor Peter Gotch in it, and he's from the Cochrane Institute or Cochrane Centre in Denmark, and they're the biggest independent, as you know, medical research centre in the world. They did a 12-year study on mammography, and Professor Peter Gotch, he thinks that these surgeons that have done this to women over the last 27 years should be imprisoned for crimes against women. It's all based on the wrong information. It's all been manipulated in a way to make things appear that it's beneficial, and it's not at all. So I have this vision that hopefully, because the way that I look at it is, if we could start screening, I'm not against screening, but I'm not also for screening women that really are probably never going to have a breast problem in their life, low-risk women. So what Phil and I are trying to introduce into this country is routine screening, but with thermography. So there's no radiation, there's no clamping of the breast, nothing touches the breast. And what we do, we get a picture of a woman's breast, which is unique to her. It's like a thumbprint. And what we're trying to do by age 20 is to get the first pictures. We take 6 pictures of the breast, frontal, the axilla, under the arms, so we'll see the lymphs and things. Then the obliques, the 2 obliques to the side. And then we do the back as well, so we'll see the immune system and various other things. And if we do that 3 months later, because cancer cell doubling time kind of happens every 90 days, when we do it in 3 months' time, we can see whether there's been any cell or tissue changes. And if there aren't, we know that is that woman's pattern. And so we can confirm her thumbprint of her breast. Okay, now that will only change if disease starts to build up, or if she gets pregnant, of course, and has babies, and of course we'd have to get a new, we'd have to get a new baseline then. But the idea is to, from 20 to 30, because these young girls, okay, these are the ones with the cancer cell doubling time is so fast. Okay, these are the ones that should be being screened, could be 30, 40s, coming up those ages. There's a lot of women getting breast cancer in those ages now, compared to how it was 20 odd years ago. So every 3 years up to 30, and then every year then going up. And basically with thermography, because you're picking up early stages, you should never get to the point where they've got the tumour. You could eradicate. I know, I don't know, Dr Sarah Myhill, who's in our film, she said, Rosa, if we got a proper routine screening with thermography, using thermography and ultrasound, and anything new that comes in, because there's other new stuff coming through, you could eradicate the disease.
So do you think this is a real possibility that this will be implemented one day?
Yes, it's my life work. Believe me, in the next 20, 30 years, mammogram machines will be in museums. Actually, I always say torture chambers in museums, but they will be in there showing a time that was really not good for women. It really is that bad, and women don't realise. The majority of women out there with little lumps, bumps, things like that, will never get breast cancer, And all this is just hype, because if they put you through that treatment, there's a lot of revenue made from pharmaceuticals. They say on average about $250,000 over a 5-year period. If you go away, change your lifestyle and change the environment of the body, which is what it's all about, because cancer is a systemic disease.
It's crazy.
The tumour, actually,
we're talking reducing inflammation,
absolutely.
and we're talking the pH balance of the body is key. That's because cancer will not thrive in alkaline conditions. It will only thrive in acidic conditions. How simple is that?
I know.
So,
I know.
Somebody say, "Oh, I'm simplifying this," but really. Yeah. You can address this through lifestyle and dietary changes. Yeah. So cancer prevention is actually not as difficult as people may think.
No, absolutely.
There's always going to be genetic factors. There's always going to be other factors. Yes, I get that. And not all cancers are the same. Yeah. But there is a lot people can do.
Absolutely.
To help themselves and make sure they never go down that road in the first place.
Yeah, and it is. It's all these diseases, all these chronic diseases that people are getting are where the body is too hot. It's where things are getting out of control and warming up. And the first thing you can do, as you know, for anything is to start drinking water. Start getting that water in that body and get the flow back and cool the body down.
Ideally filtered.
Yeah, absolutely filtered. Yeah, not tap water. Yeah. And
or bottled water, which some people think it's so much greater, which it isn't, of course. It's like drinking plastic, quite frankly, diluted.
Absolutely. Yeah. So yes, all these diabetes, all these itises that we're getting, it's all down to the body being too warm and an inflammatory process going on. Yeah, and that's
of course thermography picks up on
we see that
processes, because you see that very
and
clearly.
Cooler things as well. So if somebody's got nerve damage, because these Premier football teams have brought these, so of course if they do full body scans on people, if you're going to spend millions of pounds on a player, you want to make sure, one, they're not lying to you, and you can see that if they're heading towards a stroke, or they're heading towards heart problems, or they're heading towards this sort of thing. And they use them on and off pitch as well, for injuries. Because, of course, if you've paid a lot of money for a player, you don't want him sat on the bench. So if it comes off and it's an inflammatory process going on, then he's cooling down, but you wouldn't want to put heat on that. Vice versa, if it's cold, you won't want to, put more cold on that. And thermography has been used, in St Bart's Hospital in London for 22 years in their vascular department. And the camera that they've got, because the doctor who actually does all the thermography down there, he's actually got the same camera that goes out on the space shuttle. So it's been around for a long time.
It's not new. It's not a gimmick. It's
it's a medical piece of equipment.
Absolutely, yeah.
And it's used all over.
And you have clearly you are a clinical thermographer, but you do send the scans off.
Yes, they
get analysed by medical professionals.
Yeah. So it's not me that would interpret them at all. They're all sent for analysis at the moment to America, because most of the doctors, very big over there, so most of the doctors are over there, and basically they analyse them and send them back, Absolutely.
So in terms of the thermography screening that you offer, because you travel.
Yeah, I travel around the country.
Yeah. So you do have a website, and you do have all those clinics and dates.
That's right. If you get onto medscans.co.uk, lots of information on there, lots of films as well, and lots of things. And there's all the clinics and where they are. It's just lots of information on there for people. If you get on and have a little look. So
MedScans will give people information on where to find clinics within the UK.
Yeah.
Is there a website in America that people can?
Clinics. People that have clinics. Yeah. If you go onto the ACCT website, then it will have all the clinics all over the world. They've got them in Sri Lanka, in hospitals in Sri Lanka, in Italy, everywhere. these
ACCT.
Yeah, ACCT.
Is it dot?
Yeah. .com.
.com, is it? No.
Yeah, and you can see all everywhere. Yeah, we have clinics kind of from up in the north down to the south. We do various ones in Surrey. We go to Norfolk, and we go kind of all the way up the coast, up probably as far as we've got so far is Lancaster.
And on Medscans, all that information,
yes,
people can find it there.
There's lots of other information on health on there as well, and we're collecting details of therapists that we're working with as well. Because of course, once you've had your scan, you may not want to take it to your doctor. You can take it to your doctor, of course, and you can take it. If you're a woman who's had a mastectomy, because you won't be able to have a mammogram. Thermography is a great way of monitoring things. We can send it to your oncologist or wherever you want it to go. Yeah,
that's brilliant.
Yeah.
So that's Medscans. Is it .co.uk and ACCT is .com.
Yeah.
And also the film, The Promise has got its own little web page.
Yeah.
ThePromiseFilm.net, is it?
Yes, it is. Yeah. So you can get on there. There's a trailer for it as well. Yeah. It was chosen as one of the 5 films to be shown at the Toronto Breast Festival this year, and
Fantastic.
they showed the trailer on Breakfast TV in Canada, but we can't get it on here.
Well, if anybody who obviously is interested, and not necessarily if you're a woman, I mean, any woman should see it clearly, but obviously, you know, the
I do a lot of MOTs
awareness
on there.
we generate,
the
better. So, and so thank you for sharing and inspiring people, because it may not be, we're not sitting here saying people should ditch any orthodox treatment. We're not saying that at all. We're merely sharing what you experienced and how things worked out for you and the choices that you made. And clearly it worked out fantastically well.
And can I just say one thing? Since I've been through all of this, I've met so many women who have healed themselves naturally from cancer.
Yes, I know quite a few.
So many.
I know quite a few.
And because of this 1939 Cancer Act, you will not know about it. You won't. I mean, this should be like front page news on things, and it's not. And so women are frightened, and they don't think there's any other way, and that's the problem with it, So I think, and it's really down to an individual's choice.
Yes, absolutely. And it is about just give yourself an opportunity to research. Don't jump into anything without having all the information.
Nothing's going to happen. Nothing's going to happen to you in 3 months.
That you owe it to yourself to explore different options and to do your research so that you going into whatever you choose to go into properly informed. That's all we're saying. This is not, I emphasize one more time, encouraging anybody to go against any medical advice or whatever else, but don't be afraid to question. At the same time, do not be afraid to ask questions.
That's right.
Don't just take what you're given as a fact.
Absolutely.
Because 9 times out of 10 it isn't.
That's right. It's just what they want you to be.
So people need to just be. It's about empowering people to ask questions, because that's you owe it to yourself to have all the information.
Can I quote a few things for women? Books. I was thinking of Dr. Patrick Kingsley. He's an ecology doctor. I mean, he was a normal doctor, but then he became like a naturopathic doctor. But he's got a great book called The New Medicine. .info. You can get the book on there, and there's an app on there all about breast cancer. You can download the app, or you can get the book on the full and how he treated, because he supposedly cured over 3,000 end-stage cancer patients. He's retired now, and all the things that he did with people is in that book, and it's such an inspiring book. It really is. There's that. Then there's Knockout, Doctors Who Are Curing Cancer by Suzanne Summers. That's a great book. Cancer Step Outside the Box by Ty Bollinger. So he's an American guy, basically, and he saw so many of his family die after chemotherapy and radiotherapy. So now his life work is helping people heal themselves naturally from cancer. And this October, he's doing a whole load. So if you put Ty Bollinger in, you'll find the programs on the internet. So there's all that sort of stuff going on. And he wrote that book, Cancer Step Outside the Box, which was one of the first cancer books I read. And there's also, What Doctors Don't Tell You. What a fantastic magazine that is, So much information in it. And
it is, and what they have to put up with in terms of
I know. Well, we ended up in the Daily Mail saying that I was misleading women and things through advertising in What Doctors Don't Tell You. And the way that the press turn everything round, supposedly I was saying that, that thermography could show up lumps before a mammogram. I mean, we don't see lumps. I've never said that in a million years, And then, but what it did do, it backfired, I think, on this organisation that's trying to stop anything alternative going out. Actually, I got busier after that. After a few months, I got busier because people realised actually it was a load of nonsense. But there was so much with the pharmaceuticals trying to stop information coming out and giving people choice. It's mad. Absolute madness.
But the awakening is happening because people are not stupid.
It is, yeah.
And
it is.
Clearly, that's one of the reasons why we have this show, is to actually present the information so that people can actually have a choice at least, not rather than be just bullied into something that may not be right for them.
Absolutely, yeah. But thank you so much for inviting me.
That's my pleasure. I've really, I was looking forward to talking to you. I've been wanting to do it for a long time, and thank you so much for sharing. It's inspiring.
Yeah, well, thank you very much. And you keep up the good work as well.
Thanks again, Rosa. Thank you.
Thanks.